I would like to echo sentiments about the thanks to everyone that has participated in this meeting and to the Planning Committee and to you, Kathy, for inviting me. I must tell you, I feel a little overwhelmed. And partly that is because I live in a country where we've only got 30 million people. And here you've got a much bigger population. The number of older people at the potential risk of elder abuse is far greater. So in a way you have far more complexities in this country. But as a country, I want you to also think that your borders are far greater than just your state or province or your country, and that there's research happening all over the world around elder abuse. And the challenge that I often try and grapple with is how do we capture or link or make networks much more effective across the world to capture who's doing what new suspicion indexes are being developed, where can we build from the best of the best and build on those things, really create global coalitions. And the one thing that I'd probably say that is missing in all of this is where do we get a repository or a clearinghouse with some interaction around discussion forums where groups can come together to start talking about what they're doing in these fields. Because I always say the more you can share the knowledge that you have, the more power you will have to affect change in this world. And we've heard a lot about all the elements that are happening within the US, and I think there's some great opportunities to collaborate across the globe with the work that's happening here. I was very impressed with the Hebrew Home around the virtual elder abuse shelter. I'm wanting to publicise that globally throughout our network to see if we can start replicating that in other places. So, from my point of view, where people have good ideas, I'd love to be able to talk about them and share them with our global network, which is around 10,000 consumers and organisations and governments. But the other thing that I think is vitally important is how you come together and identify funding sources and make elder abuse the priority that public health has had, what non-communicable diseases have had, particularly when you consider that the prevalence of elder abuse in this country is equal in many cases to child abuse, issues associated with non-communicable diseases. And I think there's some challenges ahead. One of the things that I asked earlier was that there is knowledge and expertise in this room that I would love to talk to. And I asked for a list of all the participants. You know, I can't get it. And the sad thing is that there is knowledge and information in this room and networks that can be formed, that it can't happen because unless you actually come and talk to individuals, none of us can get a complete list and emails of everyone that's participated in this forum. And I think that's a sad shame, because I think that is abuse in itself, because it's abusive in that it's not actually creating the opportunities for networks in the field of elder abuse. I couldn't leave this platform without also acknowledging Dr. Kalashi and Alex, a good colleague and friend for many years, and as Alex often does, he will always come up with a piece of paper and say, Greg or Jane, these things need to be covered as well. And I'd certainly echo exactly some of the comments that Alex has provided to. Education and training. Healthcare professionals across all healthcare sectors are confronted all the time by cases of elder abuse, and yet they fail to recognise it. When they do, they don't know where to go with it or how to deal with them. So we certainly need more research, particularly in the screening tools, including qualitative research and on risk factors. And I think we need to start thinking about how can we collaborate more globally than just in the US or Canada or other countries. we need to look at how we can actually make this issue a greater issue within the media. How do we develop champions for this, which actually puts it up front in the media so that we don't see the absolutely pathetic amounts of money that agencies are dedicating to the issue of elder abuse, which is really quite shameful, I think. We've talked about human rights. I come from a country in Canada which is probably the most vocally against a convention on the rights of older people. I asked the government, I said, so was it right and the right thing to do to endorse eventually a convention on the rights of people with disabilities? Is it right that we treat them in the way that we would want to be treated? And of course they can't say no. I asked, well, what's the difference with older people? And I think it's basically people look at older people as being past their use-by date. And it's sad. And I think the greater the movement towards human rights and actually building our work around taking a human rights approach to our work certainly advocates for better protections for older people as they have rights also. We've talked about identifying creative models of good practice, virtual shelters, age-friendly cities and communities. Alex mentioned those briefly, and I think if I often talk to people about the 8 domains within the age-friendly communities context, is always a good basis for including in any research components because it brings in many of the components that you would want. I certainly was impressed with Alex's presentations around how important the doorman is in Brazil. How can we build on that? How do we get the word out to interact with the people that really do know what's happening at the coalface in their own communities, whether it's the hairdresser, the barber, the synagogue, the church? How do we actually develop those processes and opportunities? And finally, the thing that I really think is missing in all of this is the intergenerational component. I really wish I wasn't here. I wish none of you were here. I wish we didn't have this issue on the table. And I think if somehow we can actually foster a movement within our younger kids around identifying and understanding what elder abuse is, that perhaps we might be able to do ourselves out of a job in the future. Thank you.